It's Health View on your talk station, News Talk 640 WFNC.
And welcome back to Health View. This is Dr. Angela Ruff, and our guest this morning is Dr. Richard Forsyth of Capital Family Medicine. Their contact number is 919-878-8596. Before the break, we were talking a little bit about some sleep disorders and insomnia with hopefully some good solutions to help you overcome that. And I wanted to talk to you about, I guess the generic name would be restless leg syndrome. I think it has fancier names than that, but I have several patients who seem to have that problem. Maybe you could tell us a little bit about that.
Actually, that's interesting, Angela. Yes, restless leg. We call this nocturnal myoclonus. That's probably just to confuse
That sounds
people.
much worse, actually.
It's pretty impressive, huh?
It is, yeah.
And basically, restless leg, when I was back in medical school, which was a while back, restless leg was basically described, but it was really thought of as being a problem mainly of the elderly, and a very uncommon problem at that. And it's very interesting that people have been complaining of this problem for years. And because most of these people will describe this as a discomfort, we doctors will kind of look all over and X-ray and do all kinds of things. But over time, it's become pretty apparent that this is more common, and it's more common in younger people. And I have a number of patients in my practice who have restless leg, and yet I continue to be fooled at times because some of my patients will come in and they will say, my legs hurt. And in the brief visits that we have with our current state of medicine, sometimes they really don't get a chance to really take the time to describe what is going on. But basically, I'll give you a brief description. They're considered uncomfortable sensations in the legs, and it's an uncontrollable desire to move the legs. You know, these discomforts can be like a burning or crawling or creeping, pulling, tingling, you name it, but it's not a cramping. It's not a cramping type pain. And but again, I think this is very good for your listening audience, Angela. I think if these people hear this and they really go and talk to their doctors, lo and behold, they can get some treatment for this disorder. But many times patients are a little, because they don't know what the heck it is, and they're probably not as descriptive about what is going on. And doctors, it's taken some changes in my way of thinking because, again, I was taught that it was a disorder of older people, and I've seen numerous people under the age of 40 with this disorder.
So does caffeine add to the problem, or are there any medications we take that tend to accentuate the problem?
You know, it's interesting, Angela. You know, I was looking at. I knew I was going to be coming on your show, and I looked at some of the causative factors. And whenever I see, as I read some article, and they start mentioning 20 or 25 things that can aggravate restless leg or some other syndrome, I kind of really wonder. I'm really skeptical. I think that they mention anemia, obesity, caffeine, nicotine, alcohol, Zantac.
Yeah. What about oxygen? Does that kind of aggravate that?
Amitriptyline, which is an antidepressant. But one of the biggest things, I think, Angela, from what I have, I've experienced in my practice, stress. I think people who are very, very stressed, I think, seem to have more problems, and the more and one of the treatments, of course, is relaxation, and I think that it's important all are to try to get a healthy enough sleep and get our exercise. All these type of things, doing the relaxation response, all these things are going to help.
Well, let me ask you this: the restless leg syndrome, does this happen while they're sleeping? And if it does it tend to wake them up, or does this prevent them from going to sleep?
A little of both. And Angela, not everybody. Most people get restless leg when they lie down. They lie down at night to go to sleep, and they just feel this just uncontrollable urge to, their legs are just uncomfortable, and they feel they have to move them. This can last about an hour, and then it gradually goes away. But there are people, and some of my patients will tell me, look, I go to a movie theater, and I sit down in the movie theater, and I've got to move my legs. And I have seen people, and people have told me that they've just had to get up and leave the theater. And you'll see people standing at the side of the theater because they can no longer sit in their seat.
I've been in some movies where I felt like I need to leave the theater, too.
Well, some of the movies will do that. They're anxiety-producing, I guess.
I just meant they weren't that good.
Right.
But
it's interesting. There are a number of medications which are very helpful. Some of them are in the minor tranquilizer line. 2 drugs have now been approved for treatment of restless leg, and those are Requip and Mirapex.
Are those tranquilizers? Or?
No, they're both anti-Parkinsonian drugs.
Yeah.
And fortunately, people do not need to take the dosages for restless leg that they have to take for Parkinson's disease. Parkinson's disease, the side effects of these drugs can be pretty severe. But in the smaller dose ranges, these drugs can be tolerated by many patients. Sometimes, I guess Neurontin, which is an anti-seizure drug, has been shown to be useful.
And so do they take this just right before they are to go to sleep?
Exactly.
Okay.
Exactly. Baclofen is an anti-spasm. It's a central muscle relaxant. Temazepam, all the minor tranquilizers, clonazepam have been used, and other seizure medications. Some people treat these things with mild pain medication, and I think, and I'm not familiar with this, but I think there's a blood pressure medication, clonidine, which some people have tried as well.
Wow. Well, it's just nice to know that there are solutions out there, especially since so many people tend to suffer from this.
I really feel I've had some of my patients have done quite well, especially with Requip. It's been quite useful. And it's funny, I can say that now that a number of my patients, because it just shows you that I'm out doing general adult medicine, and yet I have a number of these patients in my practice.
Well, it definitely either we're more stressed and it's causing it, or maybe people are just more aware that it's a problem, huh?
I think probably a little bit of both.
Sure.
A little bit of both.
Besides that, I've heard of some people just when they go to sleep, they tend to have these night sweats. What are your thoughts about that, and perhaps some solutions for that?
Well, it's obviously when we hear about night sweats, the average physician, starts, thinking of, the possible more serious problems causing night sweats, which of course would be lymphoma and tuberculosis. But when we night sweats are very, very common, Angela. I have a number of patients who come into me, and especially now, and I know I've been on talking about whole foods eating and trying to avoid heavy carbohydrate load. But I think that night sweats can be a sign of people who are just ingesting a large amount of carbohydrate at night. When you break down carbohydrate, you produce heat and water. And, of course, that makes for a very nice night sweat. So a number of my patients, when I convince them that they've got to stop eating pasta at night and cookies, cakes, pies, etc., that is highly effective. And, of course, some people have that night sweat in the middle of the night because they've eaten all this high-carbohydrate food, and they've gotten a very high insulin production. That insulin production has lowered their blood sugar, and they're getting into a night sweat because their blood sugar is low.
For hypoglycemia.
So you can get it both ways, and night sweats. Some people are taking a lot of aspirin or other medications, and sometimes some people will sweat with certain medications.
And let's not forget my favorite, menopause.
Oh well, we can never forget menopause. That goes without saying, huh? But yes, that is certainly a night sweats, day sweats, you name it.
All kind of sweat, but I guess maybe hormonal therapy might help prevent some of those symptoms.
I'm a big believer in hormonal therapy. I know it's been controversial, Angela, but I still feel, especially for women who've had hysterectomies, that the good of a little bit of estrogen far outweighs the risks, provided it's started early. I think that if women are going to consider taking estrogen treatment, I think they should start taking it, in the onset of menopause and not wait 10 years before they institute hormone therapy.
Right. Okay, this is a totally different subject. Of course, Fayetteville, we have a very transient population with the military. A lot of people travel, commute by air a lot. And so jet lag can kind of interfere with people's sleep and just the general ability to feel good. I know you're a pretty big world traveler. What are some tricks of the trade to help people get over jet lag?
Well, what I like to do when I travel, I like to get on the airplane tired. I think that really helps. So maybe I'll get up a little earlier, maybe go to bed a little late the night before, and that's kind of helping you shift. But for instance, going to Europe, that's a lot of my patients complain about just not being able to get on to European time. And that's where, if you can get on that plane, you be a little tired, and you immediately set your mind, it's 6 hours later. When they serve that meal on the plane, you eat it. And even before you eat it, that might not be a bad time to take a melatonin even before the meal. So you're sitting down, you're having your melatonin, and you're eating your meal, and maybe that might be a time when, I'm not big on fatty food, but that might be a good time to maybe eat something with a little bit of a little fattier than usual.
Right.
And maybe because you're not going to be sleeping a long time, and that might even be a time if they're going to serve a glass of wine with the meal. I think that would be okay. But I think the melatonin, your meal, and as soon as that meal is over, it is not the time to start playing video games on the machine. You've got to recognize that.
They're so tempting.
Pardon?
They're so tempting.
Oh, they are. They are. Well, I could tell you, Angela, briefly, my young son and I went to Italy. And, of course, I followed all my regime, and my young son, being 17 at the time, ignored everything I had to say. And I woke up the next morning, and I saw him staring into a video screen. And he was on American time for the next week.
Oh, my goodness.
And I got up that day. We got into the hotel, and I walked around. I did my scouting trip of Rome and walked around Rome for 6 hours that day. Had a full day and felt pretty good.
Well, hopefully at least got him a Rick Steves book so he could know what Italy really looked like, right?
I brought him back some nice pictures, Angela.
There you go. That's good. Well, you're listening to Health View. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Richard Forsyth of Capital Family Medicine. We'll be right back after these messages.